You know, do you know, can anybody think of a simulation that everybody in this room has done at least one time? A fire drill, exactly, exactly. So simulation is to basically prepare you for unexpected things. You know, we actually embrace mistakes. So you really can't do anything wrong. The purpose is for you to have some fun, and if we actually teach you something too, that's a benefit. And we also play by Vegas rules, which means whatever happens in the Sim Center stays in the Sim Center. And that way, it's a nice, safe learning environment.
And really interested in the idea of really the necessity for interdisciplinary collaborations.
And incredibly interested in multidisciplinary collaboration and the idea that people, professionals and people who are working should be constantly working together. And so since we're going to eventually reach that point as students, we should start now.
And I'm here today because I was just like, it seemed like it was very interesting just to see a collaboration between like medicine and public health and just working together on those different health issues that we're going to be working with in the simulation.
Keeping up, so it's kind of a catch-22. You need funding to keep up, but then we're not going to fund you if we don't see that it's worth it to get you up.
But the other option is that they're seeing, this is the hospital system that's taking care of the urban poor, a lot of whom probably don't have insurance, and so the hospital is probably losing money each year, paying for patients that can't pay back, and so there's only so long that I guess you can continue that way.
Well, some of them are probably on Medicaid or Medicare, so then
Alright, so you're going to go in, you're going to bring your syringes, and are you going to do a test sample or are you just going to hit everyone?
I think since there's people that's dead or killed, I would, this may sound weird, but I would test on them first.
Yeah.
Just to see what's the effect of it when we put the antibiotic. And then if it's effective, then I would move on to the next.
How does that work in depth?
You already know that the antibiotics work on the bacteria because that's been tested in the lab.
Okay.
Oh, so we're just afraid maybe they might have an allergic reaction to it or something?
Yeah.
And also the
Ethical.
Ethical and legal
Yeah.
issues.
We're still not consenting though, that's the problem.
Yeah.
Unstable?
Can we get like consent from family members? Because I'm assuming that this would probably get some kind of media coverage.
Oh, thank you, doctor. You're a very nice doctor. You've got pretty eyes. Oh, that's good. Okay. It's the mapopolalo.
I think what I gained is the softer skills of communication with the teamwork, and you talk about it all the time in medical school, and you think that you can practice it, and like you think when you're out in the field, but you don't actually have a safe space early in your training to actually implement that, where it's not about the medicine, it's completely, the focus is on patient, team care, coordinated care. And I think this is the first time I'm like, oh, that was like our training in a safe environment where we can make mistakes and we can talk about it and debrief and feel vulnerable and share our feelings and emotions, things that you would not necessarily, when it's hard science, it's hard to do as well. So I think that this is awesome, and I think we should do more integrated curriculums.